Hello everyone, welcome to NEET PG Live Daily. Myself Dr. Apoorva Mittal, and today we'll have image-based MCQ questions. And today will be the lecture 1 in which I'll be covering 10 image-based questions, and I'll be giving you a scenario and you have to answer accordingly. And tomorrow we'll have another image-based questions, lecture 2. So welcome to Unacademy friends. Unacademy is India's leading platform for online courses, and by getting the Unacademy Plus subscription, you'll be able to avail the live classes for all the 19 subjects and also interact with the educators, and also we'll be having daily test series and analysis through which you can evaluate your progress and also come to know how exactly the questions are asked, and also live doubt clearing sessions in which you can clear the doubts pertaining to that subject to the educators. So that is about the Unacademy Plus subscription. So let's start our today's topic, that is image based question. Friends, am I loud and clear? Am I loud and clear? Okay, should we start? Should we start? Okay, fine. So the first image for today is after insertion of the central venous catheter. Okay, the patient developed shortness of breath, tachycardia, and decreased air entry on the right side. On taking the X-ray showed following feature. What can be the cause for this X-ray? Okay, तो एक पेशेंट में सेंट्रल वीनस कैथेटर डाला. After insertion, the patient developed shortness of breath, tachycardia, and they on auscultation we found that there is decreased air entry on the right side. X-ray showed the following features. What can be the cause for this? A. Air embolism, B. Pneumothorax, C. Hypovolemic shock, or D. Aortic dissection. Friends, I'll be giving you 15 seconds. I'll be giving you 15 seconds. Just answer this. Okay. See the X-ray, what you find in the X-ray, and come to the diagnosis. A. Air embolism, B. Pneumothorax, C. Hypovolemic shock, or is it D. Aortic dissection? What should be the answer for this? Just give me a second. Okay, what should be the answer? Okay, can you see this X-ray? Can you see this X-ray? In the X-ray, what all should we see? Okay, in the X-ray, we should see the airways. Okay, we should see the lung. We should see the lung, outline. So in the right side, we see that there is a lung collapse. Okay, right side may see there is a lung collapse and there is formation of pneumothorax. So, and also a very important finding, there is insertion of ICD. See, can you see this ICD over here? Can you see this ICD over here? Okay, so this because of the central venous catheter placement. Okay, because of the central venous catheter placement, we can puncture, we can develop pneumothorax. Okay, because of the injury to the lung apex, and basically it is seen more with case of this. It is seen more in case of the when we get the excess of the internal jugular vein. We see it more in case when we get the subclavian Okay, so because of the insertion of the central venous catheter, okay, we can injure the lung apex, and therefore there can be formation of the pneumothorax, and because of the formation of the pneumothorax, the patient developed shortness of breath, tachycardia, and on auscultation, because of this lung collapse, we saw that there is decreased air entry. So the answer for this is pneumothorax, that is B. That is B, by seeing this feature. Okay, now why is it not aortic dissection? In the aortic dissection, what X-ray finding will get? We will find that there is widening of mediastinum. Okay, there is widening of mediastinum. So these features are seen in the aortic dissection. If the patient has aortic dissection, the patient will be hemodynamically unstable. Okay, the patient will be hemodynamically unstable. Air embolism के cases में, yes, on insertion of the central venous catheter, there are chances कि patient को air embolism चला गया in the right side of the heart. Okay, in the right side of the heart, and there is ventricular perfusion mismatch. Okay, and there is ventilation perfusion mismatch in this. Okay, but in this we won't get the X-ray finding like this. We won't get the X-ray finding like this, and the clinical features in that will be, clinical features in cases of air embolism will be, if okay, the patient will have sudden collapse, the patient will have sudden collapse. Okay, there will be shock. Okay, the BP will fall. There will be bradycardia. There will be bradycardia. Fall in SpO2. Okay, fall in SpO2. So these are the features that we see in cases of air embolism. Is it clear? Is it clear? Any doubts in this? Any doubts in this? So after insertion of the central venous, and it is more common, okay, the lung injury is more common if we cannulate the subclavian vein. Okay, it is more common if we cannulate the subclavian vein. It is more prone to cause injury to the apex of the lung and cause the pneumothorax. Okay, और इसमें अल्ट्रासाउंड फाइंडिंग क्या होता है इन pneumothorax? Okay, in pneumothorax, if there is development of the pneumothorax, when we will do ultrasound, there will be loss of sliding sign. Okay, there will be loss of sliding of the pleura over the lung. So that these are all features which are seen in cases of pneumothorax. Is it clear? Is it clear? Now coming to the second question. A oil-based cream is applied over intact skin, okay, to prevent pain due to insertion of intravenous cannula. What are the constituents of this? What are the constituents of this? So a oil-based cream is applied over the intact skin to prevent the pain due to insertion of intravenous cannula. What are the constituents of this? A. Lignocaine and procaine. B. Lignocaine and tetracaine. C. Procaine and prilocaine. Or D. Lignocaine and prilocaine. What should be the answer for this? What should be the answer for this? Okay. Please read the question carefully and tell me. The oil-based cream is applied over the intact skin to prevent the pain due to cannula insertion. What are the constituents? Is it A. Lignocaine and procaine, lignocaine and tetracaine, procaine and prilocaine, or is it D. Lignocaine and prilocaine? What should be the answer for this, friends? I'm waiting for the answer. I'm waiting for the answer. Can you please tell me what is the cream that is used, the oil-based cream that is used to as a local anesthetic to prevent the pain during the cannula insertion? Okay, the answer over here is D. I'm sorry. The answer over here is D. That is lignocaine and prilocaine. That is lignocaine and prilocaine. Now, what is EMLA? It is basically, it is a oil-based cream which acts as a local anesthetic. It is a eutectic mixture of local anesthetic. And in this, either 5% of lignocaine, okay, 5% of lignocaine plus 5%, remember, prilocaine. Don't get confused with procaine. I have told you many times in the class, during the class, in this 5% of lignocaine plus 5% of prilocaine is present, and when this is applied over the intact skin, okay, there is local anesthesia, and therefore insertion of the cannula becomes painless. Okay, and this is mainly used for the pediatric age groups, because it is very difficult for us to cannulate them, and it is applied over the intact skin. Okay, at least 1 hour before the cannulation, and the effect remains till 2 to 4 hours. Okay, and the effect remains till 2 to 4 hours. Now, can you tell me one of the side effect of prilocaine? One of the side effect of prilocaine. Okay, prilocaine, it can cause methemoglobinemia. Methemoglobinemia. One liner question. What is the treatment for methemoglobinemia? What is the treatment of methemoglobinemia? That is methylene blue. That is methylene blue. Is it clear? Is it clear? Any doubts in this? Okay. So in this, oil-based cream is applied over the intact skin to prevent, okay, to prevent the pain due to the intravenous cannula. What is it? Okay, what is the cream applied? That is eutectic mixture. It is a eutectic mixture, and it is nothing but 5% of lignocaine plus 5% of prilocaine. Okay, now coming to the third question of today, that is, please see this image. Which of the following inhalational anesthetic agent reacts with it? Okay, this is the diagram, which is an image which is given. Which of the following inhalational anesthetic agent reacts with it? Is it A, isoflurane, B, ether, C, halothane, or D, sevoflurane? Okay, what should be the answer for this? Which of the following inhalational anesthetic agent reacts with it? A, isoflurane, B, ether, C, halothane, or D, sevoflurane? Can you see this? Can you see this? Can you see this? What it is? Soda lime. What it is? Soda lime. What is soda lime used for? What is soda lime used for? It is used in the closed circuit, it is used in the closed circuit to absorb carbon dioxide from expiratory gases, so that is the function of soda lime. Okay, what are the constituents of the soda lime? The major constituent of soda lime, can you tell me what is the major constituent of soda lime? That is calcium hydroxide. Okay, other constituents are sodium hydroxide and potassium hydroxide. Is it clear? Is it clear? So what is soda lime made up of? The soda lime, calcium. Yes, Dr. Piyush, it is calcium hydroxide. That is the major constituent of soda lime. Okay, and the other constituents are sodium hydroxide and potassium hydroxide. Now what happens is, this is the anesthesia machine. Okay, and this is the patient end. What happens in the closed circuit? From the anesthesia machine, the inspiratory gases go towards the patient. है ना. Inspiratory gases like oxygen, volatile anesthetic, plus if nitrous oxide or air, it will go towards the patient, and from the patient the expiratory gases will come out, that is carbon dioxide plus residues of volatile anesthetic. Okay, now these passes through the carbon dioxide absorber. Carbon dioxide absorber that most commonly used is the soda lime. ठीक है. And the volatile acid residues, they are recycled into the anesthesia machine. Okay, and remember 100 grams of soda lime can absorb around 23 liters of carbon dioxide. This is also very important. Okay, this is also very important. That is 100 grams of soda lime. ठीक है, it absorbs around 23 liter of carbon dioxide. ठीक है, but it is when the soda lime is fresh. When the soda lime is exhausted, what will happen? The carbon dioxide won't be absorbed, and as the carbon dioxide won't get absorbed in this, it will be rebreathed by the patient. So what are the signs of soda lime exhaustion? What are the signs for soda lime exhaustion? First of all, it has an indicator. Okay, and in our clinical practice, the most common indicator used was mimosa red. Okay, so initially when it is fresh, it is pink in color. When it is exhausted, it will turn into white. Okay, other signs are there will be tachycardia. Okay, tachycardia, the patient will have shallow breathing. Okay, the patient will have shallow breathing, tachycardia. These are the features of the soda lime exhaustion. These are the features of the soda lime exhaustion. Okay, what will be the capnographic finding in case of the soda lime exhaustion? As I told you, what is EtCO2 upon time? Okay, there will be carbon dioxide even in the inspiratory gases, so it won't touch the baseline. Okay, so our EtCO2 graph would be something like this, because there is carbon dioxide even in the inspiratory gases, so it won't touch the baseline. So it is a typical feature of soda lime exhaustion. Now, when the volatile anesthetic used is sevoflurane, okay, sevoflurane, what it does is, sevoflurane, it reacts with soda lime, okay, to form a compound A, which is basically vinyl ether, and this is nephrotoxic. Similarly, if the inhalational agent which is used is desflurane, it reacts with soda lime to form carbon monoxide and therefore causes respiratory depression. Okay, so these two are the inhalational anesthetics which, when used in the closed circuit, can react with the soda lime. Okay, the sevoflurane, it reacts with the soda lime to form compound A, that is nephrotoxic, and desflurane, it reacts with soda lime to form carbon monoxide, which causes respiratory depression. Therefore, other carbon dioxide absorbents which can be used are berry lime. Okay, are berry lime. Problem is, there is less amount of formation of compound A and carbon monoxide, but it is less potent. Than soda lime. Is it clear? Any doubts in this? I'm sorry. Any doubts in this? Okay, so therefore the answer for this question was D, that is sevoflurane. Sevoflurane will react with the soda lime, okay, and it will form compound A, which is nephrotoxic in nature, Okay. Now that is what I have asked. What is the compound form with the sevoflurane? So sevoflurane, when it reacts with soda lime, it forms compound A, which is nephrotoxic in nature. How much carbon dioxide can 100 grams of soda lime absorb? It is around 23 liters. What are the constituents? The major constituent is calcium hydroxide. The other constituents are sodium hydroxide and potassium hydroxide. Okay, what happens when desflurane is used? When desflurane is used, it will react with it to form carbon monoxide, which causes respiratory depression. So these are the questions which can be asked from soda lime. Is it clear? Okay. Coming to the fourth question. Okay, this vaporizer, ये जो vaporizer दिख रहा है, this vaporizer is used for which inhalational anesthetic agent and what is the MAC value of it? Okay, this vaporizer, ये जो vaporizer है, it is used for which inhalational agent and what is the MAC value of it? Is it A, isoflurane and MAC value is 1.2? Is it B, isoflurane, the MAC value is 0.75. C, desflurane, MAC value is 6, or D, desflurane, MAC value of 2. So what should be the answer for this? Okay, we all know that the vaporizers are specific. For different inhalational agents. So ये जो vaporizer है, which is blue in color, it is specific for which inhalational anesthetic agent? Is it isoflurane or is it desflurane? And what is the MAC value? If it is isoflurane, then what is the MAC value? If it is desflurane, then what is the MAC value? MAC, you know, it is minimum alveolar concentration. है ना? It is the minimum alveolar concentration. What should be the answer for this, friends? Please answer. Okay. So as you can see, ये vaporizer का color क्या है? That is blue in color. So it is a vaporizer for desflurane for sure. Now what is the MAC value for desflurane? The minimum alveolar concentration. What is the MAC value of desflurane? That is 6. Okay, that is 6 and therefore the answer is C. Okay, so coming to the important questions from desflurane. Yes, Dr. Kunal, it is C. Welcome to the class. Okay, so it is C, that is desflurane, and the MAC value is 6. Now coming to the questions on desflurane. Okay. Okay, for the desflurane, okay, it has a boiling point. Okay, the boiling point of desflurane is around 22.6 degrees Celsius, that is at the room temperature, and therefore we need special vaporizer. We need a special vaporizer that is known as Tech 6 vaporizer. Okay, Tech 6 vaporizer. Remember this. Okay, desflurane, as the boiling point is same near to the room temperature, therefore we need special vaporizer which is known as the Tech 6 vaporizer. Halothane, now halothane. Okay, isoflurane, sevoflurane and desflurane. ठीक है, हेलोथेन के वेपोराइजर का कलर क्या होता है? दैट इज रेड इन कलर. एंड व्हाट इज द मैक वैल्यू? मैक वैल्यू ऑफ हेलोथेन इज 0.75. The MAC value of halothane is 0.75. isoflurane. Isoflurane, it is purple in color. Okay, the vaporizer is purple in color and iska MAC value is 1.2. Okay, it is 1.2. It is 1.2. Sevoflurane. Sevoflurane, it is yellow in color. The vaporizer is yellow in color or iska MAC is 2. Okay, it is 2. So CO S ऐसे लिखते इसका mirror image 2. तो CO का MAC value is 2. Is it clear? Desflurane, ठीक है, desflurane, इसका vaporizer, it is blue in color, that is special vaporizer Tech 6 vaporizer, and इसके ऊपर ऐसे लगा देंगे तो क्या बन जाएगा, D से 6, so इसका MAC value is 6. Is it clear? Is it clear? Dr. Kunal, is it clear? So these are the different vaporizers for different inhalational agents. So red color is for halothane, yellow color is for Sevo, and purple color is for ISO. Okay, that is for ISO. Okay. Is it clear? Can I move to the next question? Okay. I think there is some lag. Dr. Kunal, are you with me? Okay. Question 5 is identify the breathing circuits. Identify the breathing circuits and which type of respiration it is used for. Okay, so what I am asking is identify this breathing circuit and which type of respiration it is used for. Is it A, Mapleson D, and it is used for controlled ventilation, or it is B, Mapleson A, and it is used for controlled, or C, Mapleson D, that is used for spontaneous, or it is D, Mapleson D. I'm so sorry, the options, okay, please take it as A. Okay, Mapleson A circuit, which is used for spontaneous, or if it is Mapleson D, which is used for spontaneous respiration. What type of breathing circuit is it? Identify the breathing circuit and which type of respiration is it used for. What type is the breathing circuit and what type of respiration is it used for? What is the answer for this? I'm waiting for the answer. What should be the answer, Dr. Kunal? What should be the answer for this? Is it Mapleson A or is it Mapleson D? And if it is A, which type of respiration it is used for? If it is D, which type of respiration is it used for? So, the breathing circuits, okay, the breathing circuits, the answer of this is C. Okay, the answer for this is C. It is a Mappleson's type A and it is used for spontaneous circulation. This Mapleson type A and it is used for spontaneous circulation. Now, ये जो breathing circuits हैं, okay, the breathing circuits, the semi-closed circuits, okay, the semi-closed circuits, these are Mapleson circuits. Mapleson circuits. And these are divided into A to F type. A to F type. Now, depending upon where is the APL valve present, okay, if it is present, this is the, okay, what are the components of the breathing circuit? The components of the breathing circuit are, okay, this is the patient end, APL valve, okay, fresh gas inlet, okay, corrugated tubing, and the reservoir bag, So these are the components of the Mapleson circuit. Now, depending upon where is the APL wall and where is the fresh gas inlet, these are divided into A to F type. Okay, if the APL wall, this is the patient end, okay, and this is the machine end. If the APL wall is present near the patient end, okay, if the patient APL wall is present near the patient end, okay, then it can be A, B or C type. Okay, it can be Mapleson A, B or C type. Now, in A type, the fresh gas inlet is present away from the patient. Okay, it is present away from the patient, and therefore इधर क्या है, APL wall is present towards the patient and fresh gas inlet is present away from the patient. That means it is Mapleson type A. In Mapleson type B, the fresh gas inlet is also present towards the patient. ठीक है. In type C, it is same as B, but the corrugated tubing is absent. ठीक है. In C is absent. In Mapleson type C, the corrugated tubing is absent. Is it clear? Is it clear? B and C are obsolete. A, if it is used, it is best used for spontaneous circulation. Because if it is used for the controlled circulation, then we have to keep the fresh gas flow at a very high level. Okay? So therefore, the answer is Mapleson A, and therefore it is used only for spontaneous circulation. Now, what about Mapleson D, E and F type? What about the Maplesons D, E and F type? Okay, Mapleson D is opposite of A. That means the APL wall is present away from the patient and the fresh gas inlet is present near the patient. ठीक है. So D is opposite of A. इसका उल्टा कर दो. ठीक है, यहाँ पे APL वॉल्व लगा दो, यहाँ पे फ्रेश गैस इनलेट लगा दो. So that is D type, and modification of Mapleson D is what is Baines. Modification of D is what is Baines. Is it clear, Dr. Kunal? Is it clear? Others, is it clear? Any doubt in this? Okay, E. In the E, reservoir bag is absent. Okay, and the APL wall is present away from the patient, and this is an example of ISTPs. F, it is Jackson's-Rees, okay, modification of type E, and in this the reservoir bag is present. Okay, so E and F type, as the APL wall is present away, okay, from and the reservoir bag is absent in E, and in the F the reservoir bag is present. These two are used in the pediatric age group. These two circuits are used in the pediatric age group. Is it clear? F, Jackson's-Rees circuit, which is a modification of type E, is most commonly used for the pediatric age group patients. Is it clear? Any doubts in this? Okay. Now coming to the next question. So type A, first of all, type A, Mapleson type A, it is used for the spontaneous circulation. It is not used for the controlled ventilation. And if Mapleson type D is used, it is better to use it for the control rather than spontaneous respiration. Okay? Now, question 6. According to DAS guidelines, that is difficult airway guidelines, this form, ये जो image है, this forms a part of which plan? Is it plan A, plan B, plan C or plan D? What should be the answer for this? Dr. Kunal, Dr. Piyush, what should be the answer for this? According to the Das guidelines, the image that we are seeing, it forms a part of which plan? Is it plan A, B, C or D? First of all, what is it? What is it? What device it is? Okay, Dr. Piyush has answered it B. It is right. It is plan B. Okay, the answer is B. What is it? It is a supraglottic airway device. What generation? It is first generation supraglottic airway device. It is classic LMA. It is classic LMA. Now, according to the Das guidelines, okay, according to the Das guidelines, these are for the difficult airway, difficult intubation. Okay, plan A. Plan A is face mask ventilate the patient and intubate the patient Okay, that is plan A. If even after 3+1 attempts, okay, including video laryngoscopy attempts, we are not able to intubate the patient, then move to plan B. And plan B is insertion of the supraglottic airway device. Plan B is supraglottic airway device. Okay? If you are not able to insert the supraglottic airway device and ventilate the patient, then go to plan C. That is just face mask ventilation. That is plan C. What is plan D? If you are, so this is the situation where you cannot intubate the patient, If you are not able to ventilate the patient also, that is can't ventilate the patient, then you have to go to plan D, that is emergency procedure, that is cricothyroidotomy. Okay, cricothyroidotomy or tracheostomy, that is surgical tracheostomy, that is plan D. Is it clear? That is emergency approach to front of neck. Okay, in this we are doing cricothyroidotomy. Is it clear? So according to Das guidelines, this LMA, it forms the part of plan B, that is the supraglottic airway devices. Is it clear? Any doubts in this? Okay. So what are the advantages of the supraglottic airway device over bag mask and over endotracheal tube intubation? This question can be asked. See, supraglottic airway devices, okay, supraglottic airway devices, the advantages of this over bag mask ventilation is, okay, bag mask ventilation, to hold the mask properly and to form the tight seal, we need expertise. Okay, and it is tiring process. Okay, and also it increases the dead space. Whereas supraglottic airway device, it does not need any expertise. Okay, and it is easier to insert, any paramedical staff can also insert it, and through this we can also intubate the patient. Through supraglottic airway devices. Okay, and in bag mask ventilation, chances of aspiration are more as compared to the supraglottic airway devices. Now, what are the advantages of supraglottic airway devices over endotracheal tube? Endotracheal tube, it requires first proper positioning, proper sniffing position. Okay, that is not necessary with that of the supraglottic airway devices. Second, the endotracheal tube intubation, it requires laryngoscopy, okay, which causes sympathetic stimulation, and therefore patient might have hemodynamic instability. In the supraglottic airway devices, In the supraglottic airway devices, laryngoscopy is not needed and patient is more hemodynamically stable. Patient is more hemodynamically stable. Okay, in ETT, there are more chances of sore throat. Okay, the chances of sore throat are less in cases of supraglottic airway devices. Okay, is it clear? Is it clear? So these are the advantages of supraglottic airway device over endotracheal intubation. Okay, coming to the next question. True about the cuff of this type of endotracheal tube. ये जो endotracheal tube है इसका cuff. What is true about this cuff? Is it high volume, high pressure cuff? Is it high volume, low pressure cuff? C. Chances of post-operative sore throat is less, or chances of post-operative sore throat is more with this type of cuff. What is the correct answer for this? True about the cuff of this type of endotracheal tube is A. High volume, high pressure. B. High volume, low pressure. C. Chances of post-op throat infection is less, or chances of post-operative throat infection is more. Sore throat is more. What is the correct answer? You identify the tube? Did you identify the tube? What should be the answer for this, Dr. Kunal? Dr. Piyush, what should be the answer for this? Which is this tube? Okay, Dr. Piyush is telling A. What about Dr. Kunal? Okay, this is a red rubber tube. Okay, red rubber tube. The other tube which we most commonly use, that is the polyvinyl chloride tube. Okay, and the answer of this is not A. The answer of this is C. Okay, that is C. I'll tell you why. Now, red rubber tube, it is reusable. Okay, and therefore the chances of cross infection is more. ठीक है, जबकि polyvinyl it is one time use and therefore chances of cross infection is not there. Okay, first point. Second point in the red rubber tube is it is radiolucent, जबकि PVC is radio opaque. ठीक है, because of the blue light. ठीक है, third point is the cuff. Very important point, the cuff. Okay, the cuff of the red rubber tube is low volume, high pressure cuff. It is low volume, high pressure cuff. जबकि PVC it is high volume, low pressure cuff. Okay, now imagine this is the trachea. This is the trachea. Okay. Now I'm inserting a red rubber tube in this. Okay, when I'm inflating the cuff, it is high pressure, low volume cuff. High pressure, low volume cuff, and in this I'm inserting the PVC, which is low pressure but high volume cuff. Okay, which is low pressure but high volume cuff. Now, because as it is high pressure, low volume cuff, what will happen? There are more chances of pressure necrosis. There are more chances of pressure necrosis and trauma to the trachea in case of red rubber tube. But as it is low pressure cuff in PVC, the chances are less as compared to the red rubber tube, and therefore red rubber tube should not be used for long procedures because the chances of pressure necrosis is high with red rubber tube. Now, volume. Okay, the volume of this is less. Okay, so the area with which it is in contact with the trachea is less as compared to the polyvinyl chloride tube, है ना, as compared to the transparent tube, as the area of contact is less in case of the red rubber tube. Therefore, the chances of post-operative sore throat is less. Remember, with red rubber tube, because it is low volume, so the contact is less as compared to the PVC with the trachea, and therefore the chances of post-operative sore throat is less in red rubber tube as compared to the PVC. Is it clear? Is it clear? Okay, therefore the answer is C. It's a very important concept. Many questions are asked from this. Now, coming to next question. True about this part of anesthesia machine. ठीक है, ये देखो, ये anesthesia machine. What is true about this part of anesthesia machine? Okay, is it A, safety feature to prevent incorrect attachment, that is the pin index? B, it forms a high pressure system. C, it is downstream to flow meters. Or D, it is a part of the intermediate pressure system. So what is it? True about this part of anesthesia machine. Is it a safety feature to prevent the incorrect attachment, that is the pin index? Or B, okay, this is the pipelines. These are the central pipelines. So the safety feature to prevent the incorrect attachment of central pipeline to anesthesia machine, is it A, pin index, or is it a part of the high pressure system? Is it downstream to the flow meters, or is it a part of intermediate pressure system? What should be the answer for this? What should be the answer for this? Okay, all of you agree that these are the central pipelines. These are the central pipelines. So now coming to the pneumatic part. Okay, the pneumatic part of anesthesia machine, it is divided into high pressure, intermediate pressure and low pressure system. In the high pressure system, these are the cylinders and the yoke assembly. Yoke assembly, it is the part in the anesthesia machine where the cylinders are attached. And to prevent the incorrect attachment of the cylinder with the anesthesia machine, the safety feature is the pin index. The safety feature is the pin index. Okay, so that is high pressure. Intermediate pressure system. Okay, intermediate pressure system, it consists of the central pipelines. Okay, it consists of the central pipelines. First, it consists of, remember, oxygen flush. Okay, third, oxygen pressure failure safety devices. Okay, safety devices. And fourth, okay, the flow control knobs. So these are the features. These are the part of the intermediate pressure system. Okay, in the low pressure system, what we have is the rotameter. Okay, the rotameter, that is the Thorpe's tube and the bobbin. Okay, vaporizers and the common gas outlet. So these are the parts of the low pressure system. ठीक है, तो इतना तो पता चल गया. Central pipelines, the central pipelines, these form a part of the intermediate pressure system. ठीक है, now what is, okay, now what is the safety feature? Okay, what is the safety feature to prevent the incorrect attachment of the central pipeline to the anesthesia machine? That is diameter index safety system. Okay, so the answer for question 8, it is D. That is, these are the central pipeline which are the part of the intermediate pressure safety system. Okay, intermediate pressure. Okay, and central pipeline, the safety system is diameter index safety system, whereas cylinder may, to prevent the incorrect attachment with the anesthesia machine, that is pin index. That is pin index. Now, tell me, okay, this is the cylinder, color coding. I'm revising this because many questions are asked, and pin index. Okay, for oxygen cylinder, what is the color coding of oxygen cylinder and what is the pin index of the oxygen cylinder? What is the color coding and the pin index of oxygen cylinder? For nitrous oxide, what it is? For carbon dioxide, for air, okay, and Antonox. What is the pin index and the color coding for the following gas cylinders? Dr. Piyush, Dr. Kunal, are you getting my point? What I am asking? Oxygen cylinder. The cylinders, they have a shoulder and they have a body. They have a shoulder and the body. ऑक्सीजन सिलेंडर का शोल्डर का कलर क्या होता है? कैसे याद रखना था? ऑक्सीजन सिलेंडर से याद रखना है जज, and therefore the shoulder is white in color and body is black in color. ठीक है, ऑक्सीजन O2 तो इसका पिन इंडेक्स क्या हो गया? द पिन इंडेक्स इज 25. इट इज 25. नाइट्रस ऑक्साइड N से नीला, तो इसका क्या हो गया? ब्लू. ठीक है, सो इट इज ब्लू इन कलर. एंड व्हाट इज द पिन इंडेक्स फॉर दिस? नाइट्रस ऑक्साइड 2 + 1, दैट इज 35. इज इट क्लियर? ठीक है, कार्बन डाइऑक्साइड C से क्या बन जाएगा? G, एक डैश लगाते से, सो इट इज ग्रे इन कलर. ठीक है, एंड व्हाट इज द पिन इंडेक्स? C जहां पे भी आते हैं तो पिन इंडेक्स में फॉर श्योर क्या आएगा? 6. ठीक है, depending upon the carbon dioxide concentration, if it is more than 7.5%, then the pin index is 16. If it is less than 7.5%, then the pin index is 26. Any doubts in this? Any doubts in this? Okay. Air. Okay. Air, it is a mixture. It is a mixture of gases. ठीक है, तो इसका कलर कोडिंग क्या होगा? शोल्डर कौन से कलर का होगा? इन द एयर, दैट इज ब्लैक प्लस व्हाइट. इट इज द शोल्डर एंड द बॉडी इज ग्रे इन कलर. आजकल कार्बन डाइऑक्साइड का लेवल बहुत इंक्रीज हो रहा है, तो द बॉडी इट इज ग्रे but the shoulder is black plus white. And what is the pin index? That is 15. A, alphabet 1. ठीक है, 15. Antonox, it is a mixture of nitrous oxide and oxygen. So the shoulder is blue plus white. ठीक है, and body is blue and इसका pin index is 7. Cyclopropane, अलग सा ऑरेंज. ठीक है, व्हाट इज द पिन इंडेक्स? C आ रहा है तो फॉर श्योर पिन इंडेक्स में 6 आएगा. एंड प्रोपेन 3, सो इट इज 36. इज इट क्लियर? So this was just the revision of the pin index and the color coding of the cylinders. ठीक है, now coming to the next question. Please answer this question. A 40-year-old male posted for hernia repair comes for PAC. During airway examination, the oropharynx was evaluated and following structures were seen. What is the Mallampati score for this image? A score 1, B score 2, C score 3 or D score 4. What is the score for this image? What is the score for this image? Please tell me, is it 1, 2, 3 or 4? Why is Mallampati scoring done? Why is Mallampati scoring done? And what are the structures which are seen normally? I'm waiting for the answer. Please answer. Okay. 40-year-old, hernia repair, oropharynx, falling structures. So Mallampati. Okay. Mallampati classification. Okay. Mallampati score. Okay, in this what is done? The examiner sits at the eye level to the patient. The patient is asked to open the mouth as wide as possible, tongue protruding out without phonating. Remember, without phonating. And normally the structures which are seen are PUSH. Okay, normally the structures seen are PUSH, that is the pillars. Okay, so if this is the diagram, this is the oropharynx. Okay, this is the tongue. Okay, पीछे हम लोगों को क्या क्या दिखेगा? We will be able to see the soft palate, the pillars, the two pillars. Okay, the uvula, soft palate and the hard palate. I'm sorry, I'm not very good with the diagram. Okay, soft palate, and then we will be able to see the hard palate. Okay, so these are the structures which we are able to see normally. Okay, that is pillars, uvula, soft palate and hard palate. And if we are able to see all these four structures, then that is what is score 1. Okay, in the score 2 we are not able to see these pillars. ये pillars नहीं दिखते हैं. We are able to see the uvula, soft palate and hard palate. That is score 2. Okay, that is score 2. In score 3, as seen here, we are able to see the soft palate and the hard palate. We are able to see the soft palate and the hard palate, and therefore it is score 3. If I'm not able to see the pillars, uvula, soft palate and only hard palate is seen, then that is score 4. And it is used for evaluation of the oropharynx to see if, okay, to evaluate the oropharynx for laryngoscopy and intubation. So these are the structures which are normally seen. Is it clear? So Dr. Piyush, it is not B, it is C, that is score 3. Okay? Now coming to the last question. This phenomena, ये जो phenomena है, it is seen with which? With A, depolarizing muscle relaxants, B, phase 2 block of spleen, C, non-depolarizing, or D, both B and C. What is this phenomena? First of all, what is this phenomena and what it is seen with? A, depolarizing muscle relaxant, B, phase 2 block, C, NDMRs, or D, both B and C. What should be the answer for this? Last question for today. Please answer. Okay, this is, what is this? What are we demonstrating? Okay, when the first stimulus was applied, the muscle twitch was this. This we are seeing about the neuromuscular block. Okay, neuromuscular block. Okay, what are the skeletal neuromuscular agents? These can be either depolarizing or non-depolarizing neuromuscular blockers. Okay, depolarizing or non-depolarizing muscle relaxants. Okay, muscle relaxants. Okay, so this fade phenomena, the fade phenomena, that is the ratio of the fourth twitch upon the ratio of the first twitch. Okay, the train we are giving the four stimuluses and seeing the twitch response to this. Okay, the ratio of B to upon A, if there is fade, if the amplitude of B is less than that of the A, that means there is the fade phenomena, and fade phenomena, it is seen with non-depolarizing muscle relaxant and phase 2 block of depolarizing muscle relaxants. Why? Because they also act on the presynaptic nicotinic receptors, and therefore the automaticity is lost to release the acetylcholine, and therefore we get this fade phenomena. So the answer is D. So the answer is D. Is it clear? Is it clear? So friends, that was all for today's class. And on the Telegram app, we have a channel, livedaily.me or NEET PG, on which we are daily posting when will be the classes. And please install the Unacademy Learning app and select the NEET PG and get the plus subscription. The advantages of the plus subscription I told you uh, uh, in the previous slides, and you can take it for 12 months or 24 months, and I would advise, if you are in third or fourth year, to go for 24 months course, because then you'll be able to get all the live classes, and also through the regular test series, you'll be able to know what type of questions will be asked. And if you apply my code, that is Apoorva Live, APOORVA Live, you can get 10% discount on the same. And on the YouTube, we have a channel, Unacademy NEET PG. Please subscribe to it. Click the bell icon, like and share, and use my code, that is Apoorva Live, Apoorva Live, to get 10% discount on your next Unacademy.